I would like to welcome you all to today's session. I am Taiwo Olawemi, and I shall be your moderator for today. Today, we shall be considering a very interesting topic, the psychology of selling, especially as it relates to pharmacy practice, in particular, community pharmacy practice. We are particularly looking at how we can satisfy our patients even as we promote and ensure profitability and sustainability of the pharmacy business. And today we've got a very, very, very distinguished facilitator for today's session, pharmacist Yewande Adekoya. However, before we go into today's session proper, I know that some of us are listening from outside of Lagos and, of course, from different parts of Lagos. So it would be great to read from you to know where exactly you're listening and watching us from. You could type in the chat section your current location. So I'd like to see Abuja. Great, great, great. It's great to have you, Victor from Abuja. Any other person? Oh, great, from Abuja as well. Wonderful. Any other location? Please type in the chat box. Great. Lagos. I see Lagos. Wonderful. Wonderful. Any other locations? Please type in the chat box your current location. Ibadan. Wonderful. Wonderful. It's great to have you here. Any other location? Any other? Please type in the chat box your current location. Abeokuta. Wonderful. Wonderful. It's great to have you all here. You're all very welcome. You're all very welcome. And I do believe that we will have a truly insightful session today. I know that in the course of registration, we asked you what questions you would like to be answered in today's session. And it was great to read from all of you. One of the questions we had was, how do we strike a balance between making sales and pharmaceutical care in the community pharmacy setting? And that's something that would be answered in today's session. Another question we had was, what are the skills necessary to maintain optimal health outcomes and profitability of the pharmacy business? Wonderful question. Another interesting question I saw, how do you satisfy stubborn patients? Interesting. These are realistic questions that we need to be answered, especially as patients of various temperaments, various statuses in the day-to-day practice. Oh, I see Paul Hackett. Wonderful. It's great to have you here. Good day once again, everyone. Our facilitator for today is Pharmacist Yewande Adekoya. She is a trailblazing pharmacist and a multidimensional wellness coach. She had a thriving career in community practice, where she demonstrated expertise in clinical management of patients and drove sales optimization in her pharmacy, leading to double increase in revenue in her first few months at work. Yewande Adekoya is a lover of people. Her love for people and her managerial excellence led her to transition from community pharmacy practice to pharma management in Advantage Health Africa, where she's currently leading operations. In her first role at Advantage Health Africa, she oversaw about 10 pharmacies in the My Pharmacy franchise. And for all of you who do not know what exactly we do at My Pharmacy, I should tell you that My Pharmacy is the first franchise chain of pharmacies in Nigeria. My Pharmacy is also the one-stop resource center for community pharmacies across Nigeria. So say you talk about needing managerial expertise for your practice, you need recruitment for your practice, you need regular customized trainings for your staff. My Pharmacy is that one-stop resource center for end-to-end management and operations for community practice in Nigeria. Yewande Adekoya is currently the operations manager of My Pharmacy. And as the operations manager of My Pharmacy, she leads high impact projects, she drives growth and develops strategies for sales, scale, and sustainability in the My Pharmacy network of pharmacies. Yewande Adekoya's expertise in operational management is responsible for the almighty success of the My Pharmacy network. She has an agile mind. Her agile mind, resource mobilization, and talent management skills always make her stand out in every team. And we are so glad to be learning from Yewande Adekoya in today's session. I encourage you all to get your pens and paper, pens and journals ready so that you can jot down all of the light bulb moments from today's session. Please pen down your questions. You can also type in the chat box your questions. It would also be great for you to type in the chat box whatever resonates with you in the course of today's session. Do have a wonderful and insightful learning time. Thank you very much.
Hi, everybody. Can you hear me, please? Hello, can you hear me?
Yes,
Good
yes, we can.
afternoon. Okay, thank you. Good afternoon, everybody. My name is Yewande Adekoya. I'm a pharmacist, and currently I'm operations lead my pharmacy network. And today we are going to be having an interesting session on the psychology of selling. And I would give a very short story about how this webinar came alive. So I went out with Pharmacist Taiwo and my CEO, Abimbola Adebakin, for a program, and we were complaining at how community pharmacists continually struggle to satisfy patients, to meet targets, to add value in the community pharmacy practice. And I just mentioned that, there is always a psychology to selling. And, my CEO said, you must teach people this particular topic, this particular secret as pharmacists, so that they can maximize their position as professionals and also business people. So today I'll be sharing with you in the next 40 minutes to 50 minutes, what exactly is psychology of selling, what entails, what does psychology of selling entails, what does it mean to actually put customer satisfaction at the center of sales process, what does it mean, how do we balance, patient satisfaction and also, the sales target, the sales and business part of community pharmacies. My name again is Yewande Adekoya, and I would like you to please join with me attentively during this period. We're going to be having a lot of fun together. Thank you. Thank you, Taiwo, for the introduction. So today we'll be talking about, the concept of self, the key elements of selling, the characteristics of superior salespeople, understanding your customer's need, recognizing buying signal, handling objection, and also the key take home that you need to understand to help you drive performance even after today's webinar. So when we talk about concept of self, okay, what does it really mean? What does concept of self mean? Concept of self means who you are in different aspects of your life, of your pursuit. And in this meeting, on this platform, we are looking at your concept of self as a pharmacist or a community pharmacy owner. Why is this very important? I always say that this is the foundation to your success as a community pharmacist. I always see people come to me to say, oh, community pharmacy practice is boring. Community pharmacy practice is routine. You just go to work, you just, sell medicine and all of that. And that is the major problem. Why people don't understand the psychology behind community pharmacy practice and the success of it, the sales part of it. That is why pharmacists constantly struggle with being successful or even goal-oriented in their practice as community pharmacy practice. So when if you want to, the first foundation, the first step, the foundation, the foundational ideology to that psychology of putting patient satisfaction in the center of sales process and being successful at it is that it has to first come from you. You cannot give what you do not have. You cannot offer value if you are not valued. So what kind of pharmacist do you see yourself as? Who are you? Are you just a pharmacist because you went to pharmacy school? Are you just a pharmacist because you're a licensed person, because you have your full-time license, and they call you farm Taiwo, farm Yewande, farm this, farm that? Why are you a pharmacist? What kind of pharmacist do you see yourself as? We always sell in a manner consistent with our self-concept. By becoming more skilled, developing more capacity, we feel more competent and also raise our self-esteem and thereby becoming more successful. So when you see yourself as not just a pharmacist because you went to a pharmacy school, but a high-flying pharmacist because you are here to make things happen for your patient. You are here to solve people's problems. You are here to meet their health need. You are not just there because you went to pharmacy school and you read pharmacology, pharmaceutical chemistry, pharmaceutical technology, give me again, pharmaceutical microbiology, and you passed, okay? I know that we wrote over, on the average, every semester, we would write like 10 to 15 courses, every semester. So I understand that. It is very understandable that you spent at least 5 years in the university, but that still doesn't make you the pharmacist that is, self-motivated, that is successful. That doesn't make you successful in the community practice or in any area that you have found yourself. But I am restricting ourselves here to community pharmacists. So what now makes you successful? Okay, it is actually seeing yourself consistently as a skilled problem-solving pharmacist, personnel. And this doesn't just fall on your laps. It comes by constantly developing capacity, developing yourself, constantly motivating yourself to become more, to do more. So you cannot give what you don't have, except you see yourself as the pharmacist who is positioned as the authority on the shop floor to solve the needs of the people that come into the pharmacy. I always say, you are not a drug seller. It's unfortunate that we reduce ourselves to drug sellers. All we want to do when we go to community pharmacy as pharmacists is to sell the drugs on our shelves. And that is the problem. If you want to learn more about your role, okay, as a pharmacist in the universal health coverage, you can go to our page on Instagram. We did a live session, I think last week, on the role of the pharmacist as a primary healthcare provider. So you are a primary healthcare provider. Without you, okay, let me even say this, that in Nigeria currently, we have the ratio of a pharmacist to patient is 1 to 50,000. So you have 50,000 lives dependent on your practice, dependent on your expertise, dependent on your knowledge, dependent on your professionalism, dependent on your kindness to be able to get, please mute yourself if you're not muted. Thank you. Dependent on your practice, dependent on for them to get and access good health. So you can imagine if you are not that pharmacist that can solve these people's problems, you are going to be failing 50,000 people. That's a lot of people, a whole lot of many people that you cannot afford to fail. So without you understanding your role, that you're a problem solver, you are a value adder, you are not just a pharmacist because you went to pharmacy school, but you're a pharmacist, you learned pharmacy so that you can provide health good health, and improve the quality of life of the people that come to you, then we are just wasting our time. Then you can't even understand what it means to put patient satisfaction in the center of a sales project. You cannot become a successful salesperson, because I will be showing you the marriage, the relationship between, patient satisfaction and also increase in sales. Thank you. So now that we understand that it is very foundational, that you understand that the way you see yourself, the way you carry yourself, the way you perceive yourself is the way you actually, your confidence in yourself, in your practice, not just because you went to pharmacy school and they call you pharmacist, but in the value that you have to offer the public. Now that you know that it is very important in all of this success cycle ecosystem, then what are the characteristics you should start embracing? We will be looking at the characteristics of successful salespeople. The high-performing salesperson has to have a high level of self-confidence and self-esteem. Your self-confidence and self-esteem is not based on the pharmacy school that you went to. It is not based on your title. It is based on the value and the solution you have to offer the people that come to you. Because I know that I am a passionate pharmacist, because I know that it is like a burden that is laid upon me, that anywhere I find myself, I must carry out due diligence. I must be successful. I must carry out my work excellently. I must meet the need of my clients excellently. Then that is why I have confidence in my ability. This gives me a lot of confidence in my ability. While I was a community pharmacist on the shop floor, okay, I used to go to work with this energy, with this joy, and a lot of confidence, knowing fully well that I am going to solve people's problem. I have what it takes to solve people's both stated and unstated problems. As many people that come to me, I am not receiving them as people that want to buy drugs, but I'm receiving them as people that need solution for their health, to their health problems. And I am there to actually carry out and solve these people's problems. So this mindset is very important and is very foundational. It is foundational to your success as a pharmacist, working on the shop floor, a community pharmacist, and also a salesperson. How many of you agree with me that community practice, community pharmacy is 100% professional and 100% business? Okay, I think I'll be explaining that to you after this slide. Okay, so another characteristics of a successful salesperson is that they accept full responsibility for their results and look upon themselves as self-employed. One of the things I've come to realize about community pharmacists, now this is the community pharmacists who are not community pharmacy owners, is that we see ourselves as, I'm just a pharmacist. I'm here to pass time. My work hours is from 8 o'clock to 5 or 4 o'clock, or 9 o'clock to 5 o'clock. And once I finish that time, I get out. Whatever that happens during that period, I don't care. So that's why you see that we don't care whether we meet our target. We don't care whether we really do not feel it, whether we sell expiries to people. We don't feel it whether our patients get better or not. We just want to collect our salary at the end of the day, at the end of the month, because we appeared, we showed up. See, going to work is not just being physically present. It is being mentally, emotionally, psychologically present to make things happen. So when you are at work, you are there to make things happen. You are there because you know that today I am going to give everybody that comes into our pharmacy what it takes to ensure that they get better, to ensure that they feel better, to ensure that they are happy, they are delighted in our service. That way you are doing it, you are taking full responsibility of the result. And guess what? When things happen, they will not just say that, oh, it is that pharmacy in my pharmacy. It is that my pharmacy that makes me get better. They will say, it is that pharmacist Rashidat, in that pharmacy that is across the street that made me get better. So it is, our work is really personalized. You cannot take personalization away from community practice. That is why you have to be fully present. You have to take full responsibility, not just as a salesperson, but as a problem solver, because that is what is going to help you actually make more sales. Also, another thing I would like us to realize is that for successful pharmacy, community pharmacy, and also salespeople, is that they are above average ambition. Chapter said we should meet 50K as our target in the morning duty. I've made 55K now. What's there? So any other person that comes after that should just attend to them with lethargy. You don't care, you just, because you just want to make sales. No, you are not just there to make sales. You are there to make things happen. And also through that, you are able to make sales. So your ambition is not average. Your ambition is not just the owner of the pharmacy. And this also goes to community pharmacy owners. Your ambition is not just to constantly just to make sales alone. Because see, you can be making sales now because maybe you don't have competition, for whatsoever reason. But if you are not constantly ambitious, driven by the quality of service that you want to be known for, driven by always wanting to meet a need in the health sector as a primary healthcare provider that you are, I must tell you that there will be a time your sales will nosedive. It will. It is not a course, because you have to constantly, the road to success is a what they call it, is a slopy road. It's like you are climbing a hill. It's either you are going up or you are coming down. You can't stay in between. Even if it looks like you are staying in between for a while, after a while you have to come down. So you have to keep being ambitious. Either you're a pharmacy owner, and I must say this to every community pharmacy owner, every community pharmacy owner that is in this session. Your staff will not be more ambitious than you. If you peradventure have a staff that is more ambitious than you, they won't last because they want more. So the onus lies on you if you want to drive your staff. To drive yourself, if you want your staff to be high flying, you have to drive yourself. You have to be very ambitious. It is that energy that flows down to your staff. Okay, so because I have seen people that they want to do better. In fact, they did better in another client, community pharmacists, and they didn't do better in the client that they were before because the owner was not really ambitious. They just wanted them to make sales. Sales will come. It's a process, and I'll be sharing with you the psychology and the process that would help you to even eat more than the targets you ever thought about. But you need to understand the foundations, the habits, the characteristics that you have to constantly imbibe that will help you to actually meet these sales. They also have high level of empathy and concern for their customers. Like I said, it is not just about making the sales or meeting your target. It's about the fact that you go to work every day and you say you want to meet the need of these people. These people are vulnerable. These people need help. They want something to help them to become better so that they can pursue their life. And you, my colleagues, are the ones that they are coming to be able to meet this need, to be able to solve this problem. So you must show empathy. You must feel their pain. You must switch roles. If you are the one who has that migraine, how would you want to be treated? The same way you would want to be treated, with respect, with care, with concern, with the emphasis that I want this person to get better, is the same way that you should attend to your patients. I remember some months ago, that was, I think, May or sometimes in June, I can't remember, either of the 2 months. I was very down in my health. I had to go to the hospital. And I was so disappointed with the way I was attended to because the doctor did not treat me well. The doctor did not even give me attention. The doctor just wrote something for me and asked me to go. And guess what? I didn't feel better because he didn't give me attention. He didn't show me concern. He didn't even listen to me. So these people need people to listen to them, to show them care, to show them attention, because that in itself has a way of making them get better even before you dispense drugs to them. Okay, so they are also goal oriented. I think I've mentioned this in saying you have to go beyond being average. You have to be highly ambitious. They have average willpower. They are not just the people that they will say, oh, pharmacists, I don't have money for augmentin, and you just let them slide. Not because you just want to sell the augmentin, but because you know that augmentin is what is needed for them to feel better. And that is why you need to understand the psychology in the sales cycle. But you need to first embrace all this foundation so that you are able to meet your patient's need. They have determination and willingness to work hard. It's not just, like I said, it's not just about going to work and passing time. It's about going to work and taking full responsibility of what happens in your shift, of what happens in your pharmacy. If you are a community pharmacy owner, even as a community pharmacy owner, we've seen some community pharmacy owners, they're very laid back. They just want to see their staff to sell. Okay, yes, it's fine. You have worked, you're the owner, but you need to constantly motivate your staff in whatsoever capacity. Also, they believe in themselves, in their products and services and their company. Like I always tell people, people don't buy products, they buy belief. The belief you have in your products, the belief you have in your services, the belief you have that this product can help Mr. A is what people buy. Not just that, oh, this product is good, is a good antibiotic, it's going to kill the bacteria. But how will this product make them feel? Your belief that this product is going to help you get better. You feel better, you feel stronger. All this thing that is wrong with you would go. That belief is what people pay for any whatever products and services. They are absolutely honest with themselves and with other people, and they have the ability to turn strangers into friends wherever they go. And this, my dear colleagues, is going to lead me to the next slide. What are the key elements of selling? There's this thing that people say, professional sales people, professional sales coach, they talk about the know, like, and trust. People will not buy from you until they know you. When I mean buy, I'm not talking of paracetamol, I'm talking of what you tell them that they need. I'm not talking of people that come and say, oh, give me augmentin, and you sell to them. If you do that, if you are in this class and that's what you do, please go to our Instagram page and go and watch the role of the pharmacist in the universal health coverage, because it means you have reduced yourself so low to become a drug seller. It is not a patient that should be prescribing to you to sell to them. It is you that is supposed to be prescribing to patients to say, even if it is still the augmentin you will give them, you still need to educate them. You still need to let them know that you are the person who is supposed to help them for their health, and you're in the best position to do that. So, like I said, so when we talk about selling here, we are talking about you prescribing solution, also high-end solution, mid-end solution, low-end solution to your customers as you deem fit. Okay, so what are the key elements? These key elements are speaking to the KLT, the know, like, and trust factor. People will only listen to you and spend all their money on your products and services if they know you, they like you, and they trust you. So how will you make people know you, like you, and trust you? Because you can only buy from the people that you have seen that they are credible, you like the way they do their work, you are attracted about them, about their work, about their services, you're attracted to them, and you trust them that these people will not fail me. Number one is building friendship. I always tell community pharmacists that, see, until your patients start coming and saying, pharmacist, oh, today I just said I should come and greet you. Nothing is wrong with me. You have not started community practice. I've heard, I thought it was peculiar to me until when I heard like 3 or 4 people that I respect professionally, in this community pharmacy practice, say this same thing, that, patients will come and just greet you and say, "Ah, pharmacist, I just said I should greet you because, you know, they see you as their friend. They come in the evening to sit with you, to talk to you. They refer their friends to you. Those are people that will refer their friends to you. Those are people that will refer their customers, their relatives to you. You know, even their enemies, they will refer them to you because they know you have the solution. Why? Because they see you not just as somebody who wants to sell drugs, but who has their best interest at heart. So that is when we talk about the know, like. So this friendship is speaking to the know, like, and trust factor. Enthusiasm. See, I go to pharmacies and I see community pharmacies. I see the way they are even dressed. I see the way they carry themselves, the way they slouch on the seats, or the way they drag their feet. It only shows that, see, you are not interested in being at work that day. And there's no point if you're not interested in being at work to go to work. Okay, so you are being paid for your energy, for your enthusiasm. Okay, because a sale is a transfer of your enthusiasm about yourself, your knowledge, your product or service into the mind and heart of the other person. These are things that you need to understand when you want to understand the psychology of selling. So people don't buy products. I have to say it again. They don't buy products. They don't buy drugs. They buy belief. They buy energy. They buy enthusiasm. Oh, Mr. Oni, good afternoon. You came to our pharmacy today. How may I help you? That pharmacist would be so, that patient would be so happy that it's like, these people, they like me here. But you say good afternoon. Some will even be sitting there waiting for the customer to greet them. Good afternoon, sir. Is the customer will say, "Are we fighting? Greet me now, pharmacist." Some customers will not even say, but they will be like, "What's this rubbish?" And if they find another, that's why it is so difficult for a lot of us to drive loyal customers, especially when there are competitions around us. And this is to that person that asked the question that, how would you do it if you have a patent medicine store selling drugs at cheaper rate beside you? This is one of the reasons why they will go to patent medicine store and not come to you, because it's all about selling for you. You are not enthusiastic about your product or service. You are not enthusiastic to share knowledge with your patient. You are not enthusiastic to make them get better. So you need to transfer your energy, your care, your belief. It is a transfer that you need to make. And it shows in your action, it shows in your communication, it shows in your dressing, it shows in everything that you do. From the moment you step your feet into the pharmacy till you close. Another thing is personality. I think we have spoken about personality a great deal in this session. You know, a powerful sales personality is more important than the knowledge of products. I see people share knowledge of, what they call it, the drug interaction, the drug food. I'm not saying they are not important, they are very important. You know, the chain reaction, is the CH3 plus the HO2 or plus the this, that, you know, that form this, the polymer of the this. Yes, that's fine, fantastic. The pharmacological action, this action of the drug, they know it, but they will still not buy from you. Why? Because you don't have a powerful personality. You are not enthusiastic. You don't care about the patient. All you care about is what you know about nature fueled vitamin C. Oh God, it contains this phytochemicals. It contains this, what they call these things that are in this nature fueled vitamin C that helps the absorption of vitamin C. If you remember, you can please unmute yourself and share with me. You know, I forgot, bioflavonoids or something. It contains that thing that helps the better absorption of the vitamin C in the bloodstream. So, you know, they don't care. What's these jargons? All those things, they call them medical jargons, pharmaceutical jargons. Okay. What they care about is what you believe. You're enthusiastic. What you know. Yeah, you need to know about this product. But how you pass that information across to them is very important. And how the product is able to help them. Number 4, that is going to influence your patients, that will help them to know you, like you, and trust you, is your approach. Approach every client with idea of helping him or her solve a problem or achieve a goal. So many times you just want to push products on patients. You just want to share it with them. Buy and leave me alone, sir. It's even showing, yes, it's 2005. They ask you for a drug, you are telling them the price. It's 2005. Oh. All these things are things that you are approaching your work, you are approaching a patient without a sense of value. People will only trust you when they know and become your loyal customers, when they know that you are acting with their best interest at heart. And the only way people can trust that is at every point in time, you are offering value in your services, in your communication with your customer. This way, you are going to be working on the psychology of your patients that would help them to, ease up and accept you. Now that we understand that, it is important that our patients know us, they like us, they trust us through the 4 key elements that I've shared, which is friendship, enthusiasm, personality, and value. What are the thought process? Now we are going deeper into the psychology of selling. What are the thought processes that you must have? Now, I was discussing with one of our clients on Monday, and we're talking about how tough, that why is it that community pharmacy practice is tough? Why? And I said it is because there's a lot of thought processes that must go into, into your communication with a patient. It's not just something that you're going to just do. I want to buy vitamin C syrup, and you give them which one? Maybe Enzo, and you give them Enzo. Or there is no Enzo. We have Moxie, and you say how much? Oh, it's 700 naira. Okay, give me. Or it's too expensive. Don't you have a cheaper one? That's all. You are not even offering any value. You are just selling. And see, whether you're a pharmacist or not, the difference between you and somebody that is doing exceptionally well is the thought process, the valuable thought process that the person puts together, that the person has determined to push out to the patient, that will differentiate a low selling or an average pharmacist or average seller to a high flying, ambitious, and successful salesperson. So for a community pharmacist, what are the processes that must be playing in your mind immediately you see a patient or a client walk into your pharmacy? Number 1, when you want to engage a patient, you have to be clinically sound. There is the pharmaceutical thought process. There was a day that somebody came to me when I was a community pharmacist on the shop floor and asked that he said he had a headache. And I said, sit down, sir, let me check your blood pressure. And he said, oh no, I just have a headache. Just give me something to knock off the headache. And I told him, I said, sir, when you tell me that you have an headache, you just think it's an headache. But because I'm a professional, I am trained for this, I am thinking of 101 reasons why you should have an headache, because you shouldn't have an headache on a good day. So I want to know if it is stress, if it is insomnia, if it is hypoglycemia, if it is blood pressure. By the time I start mentioning causes of headache, they might just say, it's okay. Oh, yeah, anything you have to do, I will do. So I think that day was because he didn't sleep well. And I gave him something to help him calm down his nerve, and also for the blood pressure, and something to help him manage stress, because for him not to sleep well, it was because he was stressed. So you see, the thought of this clinical aspect alone is stressful. But it's interesting. If you are constantly developing yourself. So I see community pharmacists that they just feel that whatever they have learned in pharmacy school or during their internship or what they learned in that local, You need to constantly update yourself. Even what you know, what you thought you knew, you should still update it. You should still refresh yourself. Yes, I know that if somebody comes to say, I have a headache, these are the things I must do, still learn again. Keep learning. You are on a learning spree, okay? About your services. So having a comprehensive clinical awareness, knowledge, and authority on the subject matter helps you to completely stand out, that yes, it's going to help the customer say, check. This person knows what they are doing. I can listen to this person. Okay. The second thought process is the physical thought process. Your communication, both verbal and non-verbal, your body language, it must be positive and it must be in sync with what you're saying. It's not like you're just saying, sit down, let me check your blood pressure. Why do you want to check my blood pressure? The patient will ask you, let me just check it. They say we should check it, or the person is saying, this one does not even look like, even if you know what you are doing, but your body language is not speaking it. The person will be wondering, this person is just bullshit. This person does not know what he's doing. I bet just give me paracetamol and let me go. Meanwhile, it might be blood pressure that is wrong with the person, or it might be diabetes, or it might be ulcer, or it might be stress, or even kidney or liver. You never can tell. Just a headache or cancer. But how would you know if you are not, if your body language, your communication, your enthusiasm, and your clinical knowledge are not in sync? The third one that we need to know and take very seriously is the emotional thought process. What is the emotional thought process? Active listening, not just, oh, you have an headache. Okay, you have an headache. Let me check your blood pressure. You check the blood pressure. Sir, let them talk. How do you feel? Is it just the headache? Is there any other thing that is wrong with you? Do you have any question for me? We'll be talking about how you can actively engage a customer for their need analysis. Active listening, showing empathy will build trust and increase your customer's confidence in you. And it also helps you to sell effortlessly. So it's not going to, the reason we struggle is because these people don't like us or they don't trust us. So they just feel that you just want to push your product on me. But the moment somebody trusts you, he wants to get every recommendation that you make. That is why I'm always telling community pharmacists, strive to get to that point of making recommendations for your patient, not just sending the product they come. So the last one is the sales thought process. So don't try to sell your product or services. Sell the benefits. Communicate the benefits so that the benefits of your products and services to meet the customer's need. Sir, I want to check, just like you saw that the statement I made to that man consisted of my clinical knowledge, consisted of my physical knowledge. Sir, sit down, smiling, checking, are you okay? Are you fine? Take a deep breath and all of that. The emotional part is, don't worry, you'll be fine, sir. Everything will be okay. I just need to ask you a few more questions so that you'll be okay. Are you seeing? And now saying what I now gave him was to address stress, address the insomnia, and address the pain. So you need, and you saw that I did not sell, I never remember the products that I sold to him, but I remember the benefits that I sold to him. Something to help manage stress, so that his stress will not constantly help him, make him to have sleeplessness, and something to help also to influence the sleeplessness and also to bring down the pain. So you must sell the benefits of the products and not just the products to them. All right. So now that we have spoken about the things that influences the know, like, and trust, concepts that influences the psychology of the patient when you or your clients, when you want to sell to them, how do you, because here we mentioned the emotional thought process, listening to them, engaging them. How will you communicate to the patient? How do you know what they need? It is very essential that you understand the needs of your patient, you understand the needs of your client, so that you can really meet them at the very point of their need. So you need to understand, and it is very important that you understand that people do buy for a reason. not because of yours. When somebody comes to your pharmacy to buy from you, they're not buying because they just like your pharmacy. They are there because they have a problem, and that problem needs to be understood and needs to be addressed. So not just because you like augmenting to sell to them, but what exactly is wrong with them that augmenting is going to help them solve. That is why you need to do a need analysis. Are you seeing how a community pharmacist should think? So a patient comes to you, a client comes to you, they have a problem. But before then, you are going first to your workplace, to your shop floor, to the counter. You are going with authority. You are going with confidence, knowing that I am going to constantly add value to myself before a customer meets me, before a client or a patient meets me, so that I can solve their problems. And a customer comes with a problem, okay? And you say, I must first understand the need of this customer so that I can clinically, physically, psychologically, and meet the needs of this person, okay, so that it can also influence my sales. So a need analysis is a must to understand how best you can offer value that will maximally benefit the patient. So what we in Advantage of Africa, my pharmacy, we have come with a very simple way of asking relevant questions to be able to capture the needs of a client, a patient in a community pharmacy setting. With this acronym that we call WAMA, we are able to ask very intentional questions. Yes. And this acronym stands, the W stands for who is the medication for. People come into your pharmacy and say, give me Benylin cough syrup, and you give it to them. What if that cough syrup, they want to give it to a 3-month baby? So you need to know, who is the medication for? What do they want to use the medication for? So that W is who is the medication for, can be who is the medication for. What do you want to use the medication for? Do you understand what is wrong with you? The next W is what are the symptoms? So you want to buy Benylin cough syrup. Oh, it's for a child of 7 years old. Okay, safe for that child, within range. But why do you want to buy Benylin cough syrup? What are the symptoms? What is wrong with the child? Oh, it's been coughing. It's been coughing for the past 7 days. Oh, wow. So that's how long? It's been coughing. How long? 7 days. What have you given him? 7 days is a long time. Oh, we've been giving him honey, or we've been giving him palm oil and sugar, or we've been giving him Procold, or we've given him nothing. So it gives you an idea of, okay, this person is coughing. Then you ask again, is it a dry cough? Is it in the symptoms? Because someone can give you just one symptom, and you need to find out more symptoms. Is it dry cough? Is it chesty cough? Is there temperature? Is there this one fever? Is there vomiting? You now start asking questions. You need to ask for the symptoms. You need to ask for the duration. You need to ask if there's action taken, if there's any medication that's been taken so far, or if they are on any medication, especially for chronic patients. You need to ask for any allergies. The significance of this question and the answer is to establish who the patient is, what circumstances of the present case, and even the past, if there's any, and also to help you know the best course of action to take. The basic rule of selling is that people do not buy products. I think I've mentioned that severally in this webinar. They buy benefits, they buy belief. And our job in a sales or customer engagement conversation is to find out what benefits this person, and the benefits that this person is also willing to pay for. When you uncover needs by asking questions skillfully like you are, and that is why it is, like I said, very important that you are constantly developing yourself and listening carefully. If you let people talk for a time, express themselves, actively listening to them, they will tell you their basic need, and concern with regards with your product. Thank you, Taiwo. I'll soon be done. So what are the five types of needs that you need to identify when a customer is, or a client or a patient is engaging you? The first is the stated needs. They tell you explicitly what they want. For example, is I want a very good multivitamin, or I want to buy paracetamol. The second one is the real need. So when somebody comes and say, give me good multivitamin, why do you need a good multivitamin, sir? Because what they might need might be, to check their vitals first. So what they really want is the real need. Like I say, don't give drugs, don't sell drugs, but dispense, as needed. Dispense as needed, as prescribed, not just as asked. What they really want. He wants a good supplement, maybe what he needs is, he said, give me good multivitamin, but it might be what the person really need is that they want supplements for men, for libido. And he's asking for good multivitamin. I say, give me good multivitamin, and you give them supradine. And what the person actually needs is macaron for men, or, 7 C's perfect man. So that is why it's very important that you ask questions, you engage people, these people questions. They just don't come to you and say, give me this, and you give them that thing. Another one is the secret need. The ones that they are uncomfortable not to say. Maybe he wants this supplement to enhance, I mentioned that, it's sexual performance. So you need to ask for what are your problems, what are your challenges? Sometimes when you see that, that's why the psychology is very important. You need to watch their body languages too. Oh, sometimes they might be uncomfortable to talk, and you have to take them to a corner and say, sir, come to the consulting room, let's talk. And you ask more questions, and they are able to talk because they are trusting you. The unstated needs, what they do not ask for, but expect anyways. You expect great customer service from you. A client, at least that's the basic. And some unstated needs, you are going to unravel through their need analysis. Like I said, that example that I mentioned, that customer that said, oh, he just wants something to knock off the headache. But what he really was having, that he did not state was that he's been stressed and he's not been sleeping well. But if you don't ask questions, if you don't go with the mind of solving problems, but selling drugs, you are not going to be able to meet their real needs, their secret needs, and unstated needs. The last need is the delightful needs. What are delight needs? What they do not ask for, but they will be delighted to have, like checking their vitals, following them up to check on them after a few days that they've asked, loyalty programs, health education. I've come to realize that a lot of patients are always very happy when you educate them about their health, some of the things that they do not know. I am always learning something anytime I come to your pharmacy. Are you an health educator? I'm asking yourself. If you don't know that you are first also an health educator, please, like I said initially, go to our Instagram page and watch the video that we did last week on the role of the pharmacist in universal health coverage. Now, recognizing buying signals. What are the buying signals that you must recognize? Because when you understand that, when you understand these buying signals, what are the things that it will help you to achieve? It's going to help you to, to know when customers have objections and when customers are willing to buy. A customer may begin talking faster or brighten up, or ask about price or delivery, or any change in attitude, posture, voice, behavior could indicate that their buying decision is near. Sometimes you tell someone about a product or service that will benefit them. They might not be ready for it, but you have already done your part and you have sown a seed in their heart that will make them to come back another time. Okay, so that's when you say, oh, pharmacist, that's one particular supplement that you recommended for me that time and all of that, I'm ready to buy it. Okay, but this is when you are in an active conversation. You must watch their signal. It might be, oh, okay. It might be, okay, give me. Do you understand? So you must also know. And asking the closing questions whenever you see the person beginning to change the manner, like, they are beginning to be skeptical about it. Their body language is saying, "So, well, give me what I asked for." Asking questions like, "Why don't you want to buy what, get what is right for you?" It might be money, then you can even give them a better substitute. So it is very important. So you see that when you are going to work, you need to be present. Like you need to be 100% present. You need to know that you are there for your customers to solve their problems, to meet their needs, to delight their soul. Like I said, you need to watch for objections because in sales, people will also object it. They might come with objections, and you need to understand how to actually handle the objections. I'll be playing a video for you so that you can see how we can handle objections quickly.
That customers give you that stop them from buying and stop you from selling.
I'm not sure we can hear the video. Can we all hear the video?
Paris accept to name them terrorists. America and the whole world.
The major
Can you hear the video now?
customers give you from buying and stop you from selling. So let me show you 9 different
Can you hear
objections
me?
you will get on a regular basis.
Yes, yes.
Yes,
Can
yes,
you hear the video now?
Objections and to deal with
yes, we can. I can hear
Yes.
the video.
Yes, but it's not loud.
unspoken objection. The customer has concerns with your offering, but doesn't tell you anything.
It isn't loud enough.
Unspoken objections is to let the prospect talk more. Ask open-ended questions. In selling, the major obstacle
How
is
about now?
objections that customers give you that stop them from buying.
We can hear it, but the volume isn't high enough. It isn't loud enough.
This is the highest volume.
And you must learn how to
Okay.
recognize objections and to deal with them effectively. The first type of objection you will get is an unspoken objection. The customer has concerns with your offering, but doesn't tell you anything. The solution to unspoken objections is to let the prospect talk more. Ask open-ended questions like what and where and when and how and how, why and who and how and so. Lean forward. Listen intently to the answers and nod. The more a prospect has an opportunity to answer your questions, the more likely it is that he or she will tell you exactly what might be holding them back from buying. Ask good questions and listen carefully to the answers. The second form of objections you will get is excuses. Now, these are usually instinctive reactions to any sales approach. They're not personal. Excuses are not really serious either. The best salespeople, when they get an excuse, they just nod and smile and agree, and then they ask a question to take control of the conversation. The very best way to handle any initial sales resistance, including excuses and impulse responses, is with these wonderful words. This way when I first called on them. But now they have become our best customers and they recommend us and family. This immediately stops people and causes them to say, oh, really? Well, what is it that you have then? And their objections just fall away like scaffolding falling down outside a building. The next type of objections are called malicious objections. Because you call on many different people, you'll occasionally call on individuals who are unhappy or angry about their current situations. Since they cannot shout at their bosses or their spouses, they take it out on the friendly salesperson. They take it out on you. Now, these people tend to be negative in their demeanor and behavior. The way to deal with malicious objections is to realize that you are remaining calm, confident, positive, and polite throughout. And then just ask more questions about what the customer is doing and what their plans are for the future. You take control by asking questions. The fourth most common type of objection is a request for information. This is the best type of objection for you to hear because you know how to answer this as well or better than any other part of your presentation. Whenever a prospect asks for information about the results or benefits of your product or service sale. Another type of objection is the show off objection. Sometimes prospects try to show you how much they already know about your products and services. They make sufficient product or service industry. When this happens, respond by taking the low one. Show how impressed you are by how much the prospect already knows. Boy, you know a lot about this. I didn't realize that. Wow. In other words, flattery is a wonderful way to build a good quality relationship. Remember, when you make a prospect feel important by listening to him or her with rapt attention, the prospect is much more likely to warm up and buy from you in the end. The sixth most common type of objection is a subjective or personal objections. Now, these objections are aimed at you as a person. Whenever a prospect becomes critical of you, it could be a sign that you are talking too much about yourself. If this happens, it's important to make the customer the center of attention, and the subjective objections will stop. How do you do that? You start asking questions about the customer and listening closely to the answers. You may also hear the objective or factual objection. Now, these are directed at your product or service offering and the claims that you make in terms of what it will do for the customer. If you can answer an objective question like, how does this work? And how can I be sure it will do this? And what kind of proof do you have? If you can answer this type of objection, you can often close the sale. People often ask objective objections or factual objections when they're just about ready to buy and they just need a little more reassurance. The eighth most common form of objection is what we have called general sales resistance. This always occurs at the beginning of a presentation. Until you neutralize this general sales resistance, the customer will be listening to you with a closed mind. When the customer relaxes and gives you permission to ask him questions, you will immediately begin your pre-selected, open-ended questions to qualify the prospect and find out what he really needs that you can provide for him. For example, I have found if you just say, may I ask you a question? If the prospect says yes, or may I ask you a couple of questions? When the prospect says yes, the prospect has also said, I will answer the questions if you ask them. This is a wonderful way to break the ice and lower resistance. The ninth most common objection is called the last ditch objection. Now, you've made your presentation and the prospect clearly sees how she would be better off with your product or service. She knows and understands what you're selling and how much you're asking. She's on the verge of making a buying decision, but she still hesitates. In this case, you listen with respect to their final objections and then assure the prospect that yours is an excellent product or service at a good price and that everyone who is using it today is very happy with their decision. You have then overcome the last ditch objection and you can go on to close the sale.
Thank you, everyone. Thank you. So I hope we dropped also the link to the video in the chat box, so you can as well please check it out on YouTube. It's really a very loaded stuff. It is to help us to know how to handle different types of clients when they have objections to our products and services. I hope you can hear me. Thank you. All right, so we are rounding up very soon. So what are the key takeaways in today's session? So I'll be sharing with us briefly the things that we need to take away from today's session. Number one is you have to absolutely believe in yourself as a value-adding pharmacist based on the value that you have placed in yourself. Like I said, it is not just about you going to pharmacy school. It is not just about you saying that you're a licensed person, but it is about the value you constantly add to yourself so that you are able to solve your patient's problem. Remember that you are not a drug seller, but you are a value-adding pharmacist, problem-solving pharmacist, primary health care provider, a health education, an health educator, a trailblazing pharmacist, put on the shop floor to solve patients' and clients' problems. All right, believe absolutely in yourself and in the products and services that you offer. People buy belief. You must be able to transfer your enthusiasm to the mind of your customer so that they are blown by what you know, how you know it, and how you communicate it. Concentrate on the value your customer receives, not on the money you receive. Okay, so sometimes we are too fixated on the amount that we want to say, yes, sir, it's good, yes, sir. And the person says it's expensive. But why not speak more on the value? Sir, if you buy this 30 days beauty secret, your skin will be popping, your body will be strong. The joint pain that a lot of women feel when they are reaching menopause, you will not have it if you consistently use this thing. Your hair will be stronger, your nails will be finer and longer, and you will be happier. Your hormones will be thanking you. When you are talking like this to these people, when people see you will be glowing, they want to. Those are things that people want to experience in their lives. So why not focus on sharing the experiences that they will enjoy, the value that they will enjoy for this service or this product that you are giving them, what you are able to help them to avoid, the joint pain, menopausal reaction, all these things. Let them know these things. These are things that people want to spend money on, not problems. So don't be too fixated. Sometimes the next thing you tell a client when they want to get something from you is to tell them the price. That's very wrong. You are not even concentrating on the value that you are giving. Always emphasize the benefits over price. Don't mention price until the customer asks the price. The caliber of your sales pitch and your appearance must be excellent. Be an excellent person. Excellent in your skill, excellent in your dressing, excellent in everything that you stand for. Be excellent, as this reflects the perceived quality of your products and services. I always tell people when I train that when I was on the shop floor, when you come to us for to advertise a product, maybe you're a med rep or a sales rep, and you're not looking good, you are not confident in what you want to sell. You're like, hey, please let me buy this thing now. You are not first confident in your product before you even appeal to us to say we should buy from you. You are not very conversant and vast in the knowledge of your product. I don't want to buy from you. I don't believe in your product because I see you as mediocrity and I see your product also as mediocrity. And I don't want to have anything to do with such products. So people might not want to buy from you what you recommend if you are not looking, speaking, value. You must look valuable. That's why in some reputable pharmacies, you must dress well, iron your clothes, look well. It's psychology. The person is able to say, this person that is looking like this will know what they are doing. Don't look like you are hungry. Don't smile. Look neat, appear presentable. So this is very important in all that we're doing. In conclusion, the best salespeople are a lot like Riscos. They care about results, but the way they achieve them is by being relentless with developing their skills and their self-concept. Like I said, self-concept, which is the self-confidence, is the foundation to a successful salesperson. It is on it that you now build every other thing. They really understand that salesmanship is no longer about selling products. So yes, it's, oh, do they just want to talk about sales? Sales? It's not your product, but selling value to meet customers' need. What customers' need are you meeting? Are you just there to sell augmentin and antibiotics and all of these things? Are you there to meet customers' need? This mindset, matched with their constant ambition to improve themselves, makes them very successful people anyway. This is the concept. This is the foundation. This is the totality that needs to go into your personality, your character, your habit as a pharmacist who is on the shop floor to help customers or clients or patients, meet their needs, and also the psychology of selling, putting patients in the very center of the sales process. I hope that I've been able to convince you, I've been able to enlighten you that you need to embrace the psychology, all this thought process for your patient to know you, to like you, to trust you, so that they can have confidence in whatever you are bringing to the table, and they are able to effortlessly release their money, their value, to pay value for the value that you are giving them. At this point, I would like to introduce us once again to my pharmacy. My pharmacy is the one-stop resource center for community pharmacists to build a sustainable and a profitable business. So to build a sustainable and a profitable business, we have different lines of services that are directed and targeted to improve your services, to improve your business, to improve your staff, to improve your management. So I hope that with this webinar today, you are able to learn a lot on how to handle patients, how to handle objections, how to improve your services, and most importantly, also as a business, how to sell profitably. Thank you very much. At this point, I leave it to Taiwo. Taiwo, over to you. Can I still continue to share my screen?
Thank you. Thank you very, very much from year one day. It has been a truly, truly insightful session. I learned a lot personally, and I believe that the participants also learned a lot. At this time, we'd like to take questions. What are your questions? Do you still have questions after session? Which questions are yet unanswered? Please let us know. You can raise your hand so that you can be called upon to ask your questions. So it'd also be great to know what you learned. What were the light bulb moments for you? You can type in the chat box what you learned. And if you would like to speak to tell us what you learned, that's also fine. Please type in the chat box, or you can raise your hand so that you can be called upon. So we'd like to do that in about 5 minutes. Okay. Who would like to go first? Anyone? You can type in the chat box or raise your hand so that you can be called upon. Questions and comments so far? Anyone?
All right, Fantairo, can we take the questions that were asked before?
Oh, okay, great.
Yeah.
Yes, so I'll be sharing some of the questions we received. Yes, some of the questions we received before the session. So a question here is, how do you handle and satisfy stubborn patients?
Hey, okay, I think we'll learn a lot from the handling objection video. But like I said, stubborn patients are, when a patient comes to you, they're in distress, they want solution. So you handle them by calmness. You have to be firm, but you have to be calm. You have to be emphatic. let them always know that, see, Mr. or Mrs. So, or, you know, whoever the person is, I am here for you. We are here so that you can get better. We are here so that you can, so do your part by educating them, letting them know that you are here for them so that they can feel better, they can enjoy great health, not because you want to ride them, their desires, the way they feel is valid. So for people like that, active listening and always reassuring them that you are there for them is a very interesting way of, you know, making them to know, to like you and to trust you.
Great, fantastic. Thank you very much. Another question I've got here is largely related to sales. And I'm glad that you mentioned that the community pharmacy practice is both a profession and a business, 100% professionalism and 100% business tactics, so to speak. So question here says, how can you manage a pharmacy that is close to a patent medicine store, which sells a lot of medications at a cheaper rate? How do you manage that? You as a pharmacist, you are the professional, yes. However, how can you drive sales when you've got obvious competition?
So what value are you as a pharmacy adding to the community that the patent medicine store can never have? The presence of pharmacists. That is why pharmacists should not go to work with lethargy and with the mindset of just passing time. Pharmacists go to work with the mindset of meeting problems, meeting needs and solving patients' problems. Patent medicine sellers just want to sell. They just want to sell. They are not paying any professional. They are not putting aces in their this thing so that the customer can feel comfortable and all of those things. They just want to sell. So for you, are you also just there to sell, or you are there to meet people's needs? So when they come and you consult for them, you add value to them, you ask them questions, you follow them up, you do a lot of things that patient medicine stores don't do. Then they won't be, you won't even be bothered about them, because people that really want to get well, they will definitely come back to you. They will always come for you. Okay, so that is because it is value that you are offering, and people that constantly offer value, they get value in return. I hope this helps.
Amazing indeed. People who offer value get value in return. Amazing. If you still have any question, it would be great to ask your question now. So we understand that pharmacy practice can be quite demanding. And as we care for our patients, it's also important that we care for ourselves so that we can deliver maximal value to our patients. So the question here is, what's the importance of mental wellness of pharmacists in ensuring maximal customer satisfaction? What's the importance? What's the place of maximal, the mental capacity or mental wellness, so to speak, of the pharmacist in ensuring maximal customer satisfaction?
Okay, great. Well, let's say you cannot give what you don't have. If you are not in a
Sure.
very good mental state, you cannot definitely offer, you know, value, mental wellness. Because one of the things that customers or clients comes to you for is, aside their physical needs, they want also mental wellness. So you have to be in a very good mental state, and the ways you can do that, they are very much through, you know, what they call it, through stress management, improving your skills, ensuring that you also take care of your health, taking care of your needs, compartmentalizing your life, that when you're at work, you're at work. Drop your problems at your door and embrace work. As a matter of fact, one of the beautiful things that I enjoy about community pharmacy practice is that they draw us, they increase our oxytocin level, because you are relating with people, people are relating with you, you are helping them solve their problems. So that way you even feel better if you actually see it from that level, from that point of view. Okay, so that is another way of even saying, oh, I'm solving people's needs, I'm helping them live a better life. So it improves your mental wellness. But most importantly, pay attention to your mental health. If you need to see a therapist, if you need to use supplements, if you need to rest, if you need a raise in your salary, if you are giving value, by all means, you can discuss that with your boss. The environment also should be conducive. So these are things that we need to consider, to be able to be in a state whereby we are okay to be able to offer value.
Amazing, amazing. Great point. Thank you. Thank you very much, Ma. It's indeed important for us to care for ourselves so that we can effectively care for our patients. Okay, we've got a question in the chat box from Ismail, and he's asking, what tactics can one use to manage expiries?
Okay.
What effective tactics can one use to manage expiries?
Okay, so I want to believe that the person asking that question has a proper inventory management system in place. If you don't, please reach out to Taiwo. We have an effective inventory management support that we can offer you that would help reduce your inventory waste. That's expiries. So number one is you need to constantly keep track of your inventory to know these products that are expiring at least 6 months or 1 year before expiration. And you focus on those products every week. If you have like 50 products that are expiring that year, you can say every week, I'm going to push 10 of it. And out of this 10, I must read about them, know them very well, and who are my target customers. If my target customers are people that have malaria, then I know that this will be my first port of call when people have malaria. If it is antihypertensive, it means that I'm going to be checking the blood pressure of everybody that comes here and everyone that has a blood pressure. You understand? This will be the first aid that I'm going to give them. So you must know the product, know what they do, know the benefits and the value, okay? And you know your target customers. Thank you.
Great, great, great. Know your products, know the value that your products can deliver to your patients, and understand your target customers. Amazing. I see that from Adebowale wrote in the chat box all that he learned so far, the importance of being a good listener as a pharmacist, as a healthcare provider, so that you're better able to ask the right questions to know the exact need of the patient. I remember the slide on marketing insights, the 5 types of needs that we need to look out for when interacting with patients. Thank you very much for sharing that. Amazing, amazing. So if we do not have any question, I will ask that you give us your closing words.
All right. Thank you, everybody, for joining us today. The purpose of this is to actually ensure that we constantly inform the community pharmacies and the community pharmacy owner that there is more out there in community pharmacy practice than selling medicines. Like, you can do a whole lot, you can achieve a whole lot, you can grow, you can be known for something solid in your system if you embrace constant value adding practices, if you embrace growth, if you embrace capacity development. And one of the things that we do in my pharmacy is to improve the capacity development of staff, of community pharmacy owners, so that they are constantly on their feet to offer value and also to get value in return. So we have lines of trainings. We have trainings, customized trainings for you that that you can affordable customized trainings for you, for your staff, for pharmacy owners, for pharmacy managers. So you can reach out to us at info at mypharmacy.com or .africa. Taiwo, have you shared the email in the...
Yes, I have. I've shared the email address in the chat section.
Or you can call us and reach out to us, or even through our website, to know your challenges so that we can solve them. As a matter of fact, we even have a very interesting promo going on for trainings. If you subscribe to any of our customized trainings, you get a service, a skill gap test analysis for all your staff for free of charge. And this is for the 10 people, the first 10 people that subscribe to our trainings before the end of August. So please, let's embrace capacity and skill development. Let us embrace primary healthcare services. Let us embrace growth. Let us embrace value. Let us embrace value. And please, if you need more direction on this, you can reach out to us on info@mypharmacyafrica.com. So it is info@mypharmacy.africa, sorry, or call us on 08101266199. It's on the chat box. We are there for you, to consult for you, to give you services that will, spur you up. But most importantly, your mindset has to change. Your mindset has to be like, I am tired of practicing mediocrity. I want to grow. I want to do better. I want to do more. So reach out to us if you are ready for more. And we have a lot of amazing things that we can help you achieve as a community pharmacist. Thank you very much.
Amazing. Thank you. Thank you very much from Yewande. I believe that we had an exciting time learning a lot about effective sales process and improving the psychology of our customers as well as our psychology towards selling. I believe that at the end of today's session, we will return to our practice more informed and ready to deliver better and more effective pharmaceutical services to our clients. Like Famiwande mentioned, my pharmacy is the one-stop resource center for community pharmacies in Nigeria. And one of our services entails trainings, on-demand trainings, specialized trainings for community pharmacies and for their staff members. And you can always reach out to us via email, or you can call me. I already shared my phone number in the chat box. Our services, our trainings generally could be virtual or physical, depending on the needs of the pharmacy. So you can always reach out to us so that we can get talking. And like Famiwande already mentioned, we have an ongoing promo for any pharmacy that subscribes to our training packages in August. A free skill gap analysis for your staff for the first 10 training subscribers in August. So we look forward to engaging with you better. And our goal in my pharmacy is to help community pharmacies build sustainable and profitable pharmacy businesses. Thank you very much for working with us to make this dream a reality. We wish you the very best in your practice, and we look forward to engaging with you subsequently. Do have a wonderful, wonderful weekend. Bye, everyone.